Welcome to Catalyst Made Up, where we ignite understanding and make learning easier. In our today's class, we shall be looking at the anatomy of the scapula. So, introduction. Scapula is derived from a Greek word meaning shoulder blade, and it is a triangular bone which is located at the upper part of the posterolateral aspect of the thoracic cage. Location. We said it is located at the upper part of the posterolateral aspect of the chest wall. That is the location of the scapula. Extent. The superior angle of the scapula and the inferior angle of the scapula, they extend from the second thoracic vertebra up to the seventh thoracic vertebra. So, the superior border corresponds to the second thoracic vertebra, while by the inferior border corresponds to the seventh thoracic vertebra. That is about the extent of the scapula. The next is side determination. Side determination. For you to know that this scapula is right scapula or the left scapula, the following features must be satisfied. First, the posterior surface of the scapula is convex and it presents a spine known as the spinous process and divides the posterior surface into the upper and the lower part. The upper part is the supraspinous fossa and the lower part is the infraspinous fossa. That is one of the features. Another feature again is that the lateral angle, that is the glenoid cavity, is usually enlarged and it faces laterally. Another feature again is that the costal surface of the scapula is concave. So those are the side determination of the scapula. The next is the feature of the scapula. The features of the scapula. One, it has two surfaces. Two, it has three angles. It has three borders. It has three tubercles and it has three processes. So these are the features of the scapula. It has two surfaces, three angles, three borders, three tubercles, and three processes. The surface are the costal surface and the posterior surface. Those are the surface of the scapula. The surface are the costal surface and the posterior surface. The costal surface of scapula is concave, which fits the convex of the thoracic cage. It is lined by three longitudinal lines. So from here, this is the costal surface of the right scapula. You can see that it is concave and it is lined by three longitudinal lines. These are the three longitudinal ridges that lines the costal surface of the scapula, and it is concave, it is directed medially and forward. Posterior surface. The posterior surface of the scapula is convex and it is lined by a spine not called the spinous process. The spinous process divides the posterior surface of the scapula into two fossa, the supraspinous fossa and the infraspinous fossa. The supraspinous fossa is smaller compared to the infraspinous fossa. So that is about the surface of the scapula. The next is the angle of the scapula. We said it has three angles. The angles are the superior angle, the inferior angle, and the lateral angle. The superior angle of the scapula corresponds to the second thoracic vertebra, and it forms a bridge or it forms a link between the superior border and the medial border. The inferior angle of the scapula is located at the seventh thoracic vertebra, and it forms a link between the medial border of the scapula and the lateral border of the scapula. Now, the lateral angle of the scapula is enlarged, and it presents a pear-shaped structure called the glenoid cavity. Through this glenoid cavity, that is where the egg of the humerus articulate to form glenohumeral joint or the shoulder joint. So that is about the angle of the scapula. The next is the borders of the scapula. Scapula has three borders as well. The borders are the superior border, the medial border, and lateral border. The superior border of the scapula is the shortest. It extends from the superior angle up to the lateral angle. The next is tubercles of the scapula. Scapula has three tubercles, which are the supraglenoid tubercle, infraglenoid tubercle, and tubercle of crest of the spine. The supraglenoid tubercle, it is located above glenoid cavity. The infraglenoid tubercle is located below the glenoid cavity, and the tubercle of the crest of the spine is located at the inferior surface of the crest of the spine. The next is processes of the scapula. Scapula has three processes. One, the spinous process. Two, the acromion process. And three, the coracoid process. So the spinous process is a triangular plate bone that is located at the posterior surface of the scapula, and it divides the posterior surface of the scapula into the superior and the inferior fossa. The superior fossa is the supraspinous fossa, and the inferior border is the infraspinous fossa. The spinous process, it has two surfaces and the three border. The posterior border of the spinous process is called the crest of the spine, and the crest of the spine has two lips, the upper lip and the lower lip. Acromion process. The acromion process, it is a lateral continuation of the spinous process. It presents two border and two surfaces. The borders are the medial border and the lateral border, and the surface are the superior surface and the inferior surface. Coracoid process. The coracoid process, or the coracoid, is derived from a Greek word which means bent beak, and it is curved, or it is bent and finger-like projection. Another important feature of the scapula again is the fossa. The scapula as well has three fossa. The fossa are subscapular fossa, supraspinous fossa, and infraspinous fossa. The subscapular fossa is located at the costal surface of the scapula, and the supra and infraspinous fossa, they are located at the posterior surface of the scapula. In between them is the spinous process. Supraspinous meaning above the spinous process, and infraspinous meaning below the spinous process. So the features of the scapula can be easily summarized or easily understand by these two diagrams here. This is the costal surface of the right scapula, and this is the posterior surface of the right scapula. Now, we said that the scapula has two surfaces. This is the costal surface and the posterior surface. Those are the two surfaces that the scapula have. The costal is also the same thing as the anterior surface of the scapula. It has three angles. The three angles are the inferior angle, the superior angle, and the lateral angle. So from here, this is our superior angle. superior angle. Below here is an inferior angle. Then down here our lateral angle is broadened and form the glenoid cavity. So here this is our glenoid cavity. This glenoid cavity, it is the region or it is the cavity that houses the head of the humerus to form glenohumeral joint or the shoulder joint. Now that is the angles of the scapula located at the costal surface. Coming to the posterior surface, here this is our superior angle. The superior angle. Down here is our inferior angle. And the lateral part of it is our glenoid cavity. So that is about the angles of the scapula. Next is the borders of the scapula. We say that the scapula has three borders: the superior border, the medial border, and the lateral border. So from here, this is our superior border. This superior border. Remember that our glenoid cavity is only located laterally. So this is our lateral border. And here is our medial border. Now that is for the costal surface. Coming to the posterior surface, this is our medial border. Here is our lateral border. And up here is our superior border. So that is about the borders of the scapula. The next is the processes of the scapula. We say the scapula has three processes: the spinous process, acromion process, and the coracoid process. The spinous process is located at the posterior surface of the scapula. So here, this process here, or this structure, is the spinous process. This is our acromion process, and this finger-like curve structure is the coracoid process. Coming to the costal surface, we can see the coracoid process and the acromion process, but we cannot see spinous process, because spinous process is only located at the posterior surface. So up here is our acromion process. And this finger-like structure is the coracoid process. Next is the fossa of the scapula. We say the scapula has three fossa: subscapular fossa, supraspinous fossa, and infraspinous fossa. One fossa is located at the costal surface, while the two fossa are located on the posterior surface. So the costal surface is one that have subscapular fossa, whereby the posterior surface has two fossa. The upper small fossa, which is called supraspinous fossa, and the lower large fossa, which is called infraspinous fossa. Infraspinous fossa. The supraspinous fossa and the infraspinous fossa, they communicate with each other through spinoglenoid notch. Spinoglenoid notch. So this is about the feature of the scapula. The next thing we shall be looking at is the function of the scapula. What is the function of the scapula? The function of the scapula include: one, give articulation to the muscles. And the second function of the scapula is that it helps in the transmission of the weight of the upper limb to the clavicle through acromioclavicular joints. Now, the next thing is the attachment of the scapula. For easy understanding, we will categorize the attachment based on where they are found or based on where they are attached. First, we'll look at the attachment on the surfaces of the scapula. Surfaces of the scapula. We'll look at the attachment on the spine of the scapula. The attach on the borders of the scapula, the attachment on the coracoid process, the coracoid process, the attachment on the tubercles of the scapula, and the attachment on the acromion process, attachment on the glenoid cavity. So we'll be looking at the structures that are attached to this part of the scapula. First one, we said the attachment on the surface of the scapula. We've already know that the scapula has two surfaces, the costal surface and the dorsal surface. Now, the major muscles that are attached to the costal surface of the scapula is the subscapularis muscle. The subscapularis muscle is multiplicate muscle which arises from the lower pterygoid of the subscapularis fossa. This structure here will show us the attachment of the scapula. From here, this is our costal view or the costal surface. And this is the posterior surface. Now, under the costal surface, we say that the muscle that we'll be looking at first is the subscapularis, which originated from subscapular fossa. So this muscle here is our subscapularis. Now, the muscles that are attached on the posterior surface are above the spine. There is supraspinatus, and below the spine there is infraspinatus. So this muscle here is our supraspinatus, and below the spine is infraspinatus. So those are the muscle attachments on the costal surface and the posterior surface. Moving on to the spine of the scapula. The attachment on the spine of the scapula, we know that the spine of the scapula can only be seen at the posterior surface. So this is the structure we'll be using for demonstrating the muscle attachment or the attachment on the spine of the scapula. This is the spine of the scapula. We say that it is a plate bone-like structure that divides the posterior surface of the scapula into the upper supraspinous fossa and the lower infraspinous fossa. Now, the spine of the scapula has two surfaces and three borders. So, the posterior border of the scapula has two limbs, has the upper limb and the lower limb. The lower limb gives origin to deltoid muscle, whereby the upper limb give insertion to trapezius muscle. So below here is the lower limb of the crest of the spine, which give origin to the deltoid muscle, and above it, that is the upper limb of the crest of the spine, give insertion to the trapezius muscle. These are the attachments on the spine of the scapula. The lower limb of the crest of the spine give attachment or give origin to the deltoid, while by the upper limb of the crest of the spine give insertion to the trapezius muscle. Attachment on the borders of the scapula. The borders of the scapula are the medial border, the lateral border, and the superior border. To the medial border of the scapula, there are attachments on the costal surface of the medial border of the scapula and attachment on the posterior surface of the medial border of the scapula. So from here, this is the medial border. The medial border, the lateral border, and the superior border. Also, here, this is our lateral border and the superior border, medial border. Now, we are looking at the attachment on the borders of the scapula. We will look at the attachment on the medial border in the costal surface, and we will look at the attachment of the medial border on the posterior surface. Starting with the costal surface, the attachment on the medial border of the costal surface, it gives insertion to serratus anterior muscle. The medial border of the costal surface of the scapula gives insertion to serratus anterior muscle. The eighth digitation of the serratus anterior muscle, they are inserted into the medial border of the costal surface of the scapula. Now, to the medial border of the posterior surface. First, from the superior angle up to the origin of from the superior angle, this is the superior angle here. The superior angle. From the superior angle up to the origin or up to the root of the spinous process, it gives insertion to a muscle called levator scapulae. Levator scapulae. Then, opposite the spine of the scapula, it gives insertion to a muscle called rhomboid minor. And from the lower border of the spine of the scapula up to the inferior angle, it gives an insertion to a muscle called rhomboid major. So, on the posterior surface of the scapula, the medial border of the scapula gives insertion to three muscles: levator scapulae, rhomboid minor, and rhomboid major. That is about the insertion on the medial border. Now, insertion on the lateral border. The posterior surface, the lateral border of the posterior surface of the scapula give origin to the following muscles. One, teres minor, and this teres minor, it has two slits. It has two slits. In between the two slits of the teres minor, there is circumflex. There is circumflex artery. In between the slit of the teres minor, there is circumflex artery. Then, below the teres minor, it also gives origin to teres major. So, these are the muscles that are attached to the lateral border of the posterior surface of the scapula, the teres minor and the teres major. In between the two slits of the teres minor, there is circumflex scapular artery. Moving on to the superior border now. The superior border from the costal surface, we say that the superior border presents a notch which is called suprascapular notch. So, and the suprascapular notch is converted into suprascapular foramen by suprascapular ligament or transverse ligament. So from here, this is our suprascapular ligament. Suprascapular ligament. It is this ligament that converts the suprascapular notch into suprascapular foramen. Above the foramen, there is artery. In between the foramen, there is nerves. Again, the superior border also gives origin to the inferior belly muscle. This is the inferior belly muscle. Inferior belly muscle. So those are the articulation, or those are the attachments on the borders of the scapula. Next one is the attachment on the coracoid process. We say that the coracoid process is like a bent beak and a finger-like projection. Attachment on the coracoid process. pectoralis minor muscle is inserted on the coracoid process. There is also coracoclavicular ligament, and coracoid process also give origin to coracobrachialis muscle and short end of bicep brachii. So from here, this to coracobrachialis and short end of biceps brachii. It gives origin to coracobrachialis and short end of biceps brachii. It also gives insertion to pectoralis minor. It gives insertion to pectoralis minor. Another attachment on coracoid process is coracoclavicular ligament. Coracoclavicular ligament. So those are the attachments on the coracoid process from the posterior surface. From the posterior surface, we can see here this coracobrachialis and short end of bicep brachii. Moving on to the attachment on the tubercle of the scapula. We say the scapula has three tubercles: the supraglenoid tubercle, the infraglenoid tubercle, and the tubercle of the crest of the spine. This is the glenoid cavity. This cavity here is the glenoid cavity, and above it, it gives origin to long end of bicep brachii. So the supraglenoid tubercle gives origin to long end of bicep brachii. Long end of bicep brachii. Whereby the infraglenoid tubercle gives origin to long end of triceps brachii. Long end of triceps brachii. So the supraglenoid tubercle give origin to long end of bicep brachii muscle, and the infraglenoid tubercle give origin to long end of triceps brachii. That is the attachment on the tubercles of the scapula. Next is the attachment on the acromion process. This is the acromion process. From here, this is the acromion process. Acromion process. So attachment on the acromion process, deltoid muscle also originated from the acromion process. So from here, this is our deltoid muscle. Deltoid muscle also originated from the acromion process. Acromion process also presents a facet for the clavicle. Facet of clavicle. And the facet of the clavicle, it is a region which provides an attachment to the clavicle to form acromioclavicular joint. The facet of the clavicle also gives an attachment to the capsule of acromioclavicular joint. So the facet of the clavicle also gives an attachment to the capsule of acromioclavicular joint. Those are the attachments on the acromion process. Next is the attachment on the glenoid cavity. The glenoid cavity provides an attachment to the glenoid labrum. That is one of the stabilizing factor of the shoulder joint. Also, it provides an attachment for the capsule of glenohumeral joint or the shoulder joint. This is about the attachment on the scapula. Next thing we shall be discussing under scapula is ossification of the scapula. First, we should know that the scapular ossification is cartilaginous, and it is ossified by 8 centers. It is ossified by 8 centers, one primary center and 7 secondary centers. The primary center appears in the body of the scapula at around 8 weeks of intrauterine life and fuses at about 15 years. Whereby the secondary center are as follows. There is 2 for coracoid process, 2 for acromion process, 1 for the inferior angle, 1 for medial border, 1 for medial border, and 1 secondary center for the lower rim of glenoid cavity. The primary center in the body appears at approximately 8 weeks of intrauterine life and it fuses at approximately 15 years. Whereby the first secondary center on the coracoid process appears 9 years of the postnatal life and it also fuses at approximately 15 years. The remaining secondary centers appears at puberty and the fuses at approximately 20 years. So that is about the ossification of the scapula. It is ossified from 8 or by 8 center, 1 primary center for the body and the 7 secondary center, where the secondary center 2 is for the coracoid process, 2 is for the acromia, 1 for the inferior angle, 1 for the medial border, and the 1 is for the lower rim of the glenoid cavity. We should also remember that the ossification of the scapula is cartilaginous. The last thing we shall be discussing under scapula is clinical correlation. The common clinical correlation of the scapula is winging of scapula. Winging of scapula, and this occurs as a result of paralysis to serratus anterior muscle. If there is an injury to the nerve that supplies the serratus anterior muscle, definitely there will be a winging of the scapula, and the winging of the scapula is characterized by the medial border of the scapula will become unduly prominent and you cannot abduct the arm more than 90 degrees. The nerve that supplies the serratus anterior muscle is long thoracic nerve. So if there is an injury to the long thoracic nerve, there will be the paralysis of serratus anterior muscle, and paralysis of the serratus anterior muscle will cause winging of the scapula. Another clinical correlation of the scapula is congenital eye scapula, also called Springel's deformity. This is the condition in which the scapula fails to descend to its normal position in the adult. The normal position of the scapula is the upper part of the posterolateral aspect of the thoracic region. Now, if the scapula fails to descend or it remains at its origin, because the scapula originated from the neck region during intrauterine life, then it will descend to its normal position in adults, or as we grow it will descend to its normal position. Failure of it to descend down it is called the congenital eye scapula, and an attempt to bring it down either through forcefully or surgical procedure is risking injury to brachial plexus. That is the connection of the nerve that supplies the upper limb. So this is about the anatomy of the scapula. Kindly subscribe, like, comment and share. Don't forget to turn on your notification bell so that you don't miss any new video.